Hello, Matt. Nice to have you here. How are you doing?
I'm doing well. Thanks so much for having me.
Amazing. Well, today in our podcast, we'll be talking about insights about therapy tech and then how you're innovating within the mental health space with Playspace.
Awesome.
Good. So let's start with a bit of your background. What brought you to this specific endeavor and any major highlights you want to share, either from a personal, professional side of things to connect and have some context.
Yeah, so for me, my story began when I was a young child in terms of, I needed support and went to a therapist starting at the age of 7, so pretty young. At the time, didn't know many other people in therapy, if any, and was quite sort of obscure. And as I got older, I always would say that therapy is a luxury in an effort to destigmatize it. And then as my friends, in university and colleagues now in work were starting to feel anxious themselves, I recognized that it really is a luxury and that's a problem. And so I started my career basically as part of the founding team building what became the first digitally native and accessible mental health program across Canada. And when we were taking that public in COVID, which was a tremendous opportunity for the company, my therapist of 20 years came and said, Matt, now we do Zoom, you sit on your couch, but when you came in all those years ago, you needed games, you needed art, and it was things like that that allowed us to build therapeutic alliance or rapport. Is there anything out there that's compliant, that has the nuances of my very controlled playroom environment? And there wasn't any. And so that's when I realized something had to be done about it. And we started Playspace because 1 of 10 sessions are done virtually with kids today. And 80% of US counties don't have a regulated child mental health professional. So that means that 75% of kids don't have access to the specialized care that they need. And we want to sort of be a part of that solution. And that's really how we got to Playspace, which, just to give a quick sort of overview on, really is a toolkit that offers digital formats of activities and or tools that they would have in their traditional playrooms, and customizable virtual playrooms, if you will, that are integrated into video. And those can be used for virtual sessions or in person, and really create fun and immersive experiences in therapy, so they're not sterile, regardless of the care setting and the age and or condition that is being treated.
Interesting. And for the sounds of it, this covers a lot this portion of having the hybrid approach of maybe with the busy schedules everyone has to fit in these therapies, this space for kids to develop, to take care of their mental health and have it in a way that they can play or have specific strategies in place that's in a safe, controlled environment, let's say.
Yeah, very much so. And what's one thing just to note on this is that there's tremendous amounts of technology for engaging kids outside of a session, or, particular tools, whether it's, for dyslexia or for ADHD, that, products and or platforms that folks can leverage. But there really isn't anything to support in session. And what I realized is that, even take my mom, she always sat in the waiting room. She wasn't in the playroom. So most people aren't even aware that these types of engagement approaches like play are so meaningful in garnering outcomes in pediatric, adolescent, or neurodivergent care. And so what we're trying to do is, one, raise awareness that it's universal amongst clinicians that work with these populations, and it's really a crucial component of the alliance that is the largest indicator of therapeutic success and leading indicator of therapeutic success with children and adolescents.
Amazing. And just to confirm if I understand correctly how it works, let's say I'm a therapist and I will customize the plan according to the child's needs. And there's various activities I can set up and build for them so they can interact and get this in place for their very own support. Is that accurate?
Yeah, so we sort of separate the platform into two areas. One is what we call preparation, and then one is what we call sort of session engagement. And so there's the real-time synchronous, engagement component. So you're opening up a playroom and, whether it's, dollhouse, sand tray, multiplayer games, stories, slides, whiteboard, whatever you want to do, you name it, it's there. But then there's what we call sort of the preparation area. And so this is where maybe you create a different playroom that has different activities in it for a specific child. Maybe you have one that is your first session playroom that has specific things for your first session across your patients. And so you could prepare there. We have storybook generation capability. So using AI, you're able to develop a story that has images and storylines that can be personal to, again, a patient, a situation like first day of school, and things of that nature that allow you to essentially configure and personalize the experience that you'll have when you're in session prior to that.
Perfect. Okay, thanks for the explanation. And just maybe a couple other things that might be in the audience questions. If I'm like a mom and I want to know more about it or have my therapist use it, is that the way to go? Like, I'm interested, I see there's all of these space in place or a toolkit, as you mentioned. That's something that I should go and ask for it, or is there a way that will go from me as a consumer and get it, or is just through my therapist or for my kids therapist?
So there will be a future state within this company where we are actually offering products to parents, caregivers, and patients that maybe are helpful, if they don't have a provider. But really, Playspace and our mission is about improving access to and effectiveness in care for these populations. What's interesting, though, is if you speak to a therapist, I'm not a clinician. They've gone to school in many cases longer than me, and they are trained in this area. They don't feel they're not effective, and they don't feel they're not accessible. So that's not really the problem that we're trying to solve with them. But the reason I mention that is because they're actually the conduits to that type of impact. And in many cases, they're not heard. They're not being engaged with by companies like us or that are delivering care. And they end up being term takers where they, have to deliver care a certain way, or they have to deal with platforms that are really not ideal for them, that they have to make work. And our goal is to really empower therapists, because they're the ones really that are having the impact on the front lines and are the conduits to that change and will drive adoption. And so once we have lots of therapists, for example, that are, we already have lots, but I just mean as we scale and it becomes more known, we do hope that there's a world where parents or others are saying, oh, I'd love for this to be part of the session, but I don't want to have to force therapists or make them feel pressured to do something that is not what they do or outside of what they do. And so we're trying to meet them where they are today and then help them feel comfortable adopting tools that, could have meaningful impact, even if there's a little bit of change or evolution for them and how they go about it, to support the patients and the parents.
Okay, thank you. And well, focusing more on like the therapist side of things, what would you say regarding how the platform, it's like all-in-one digital platform, what is in it for them? And specifically, I know like security and those type of things and guidelines that should be in place are well taken care for.
Yeah, it's a great question. And so I'll start with the point of security is I would say the foremost consideration within the business. And I say that because there's lots of apps, there's lots of games, there's lots of products out there. The problem is that the minute you walk into a clinician's, office, or you're in a session, with a clinician, now that is a regulated environment. So the same game that you would play at home, the minute that you're in that environment might no longer be compliant. And so it's actually on the therapists to make sure that they are compliant and that all the tools they're using are compliant. And so why I mention that is because if, let's say, you want to watch a YouTube video, there might be an ad. You might and that's a problem. If you're playing a game, let's say, that might ask questions about, for, let's say, the patient's name or, any context about them, well, now you're giving that's now considered personal health information in the context of that environment. So what we're trying to do is almost create and that's why we call it a toolkit, a compliant toolkit, where not only are we creating digital formats of things that might not existed in a digital format before, but we're bringing in things that might exist already outside of a session and can be used by people at home on their own. Let's take, I don't know, Angry Birds, for example, things like that, Candy Crush. You could play those at home, but you can't actually engage with those properly in a session because of the way that they've built their infrastructure, not in compliant ways. So every aspect of our infrastructure is compliant, and we want it to be that each therapist is not worried about trying different tools and whether or not that breaches their compliance, and making it sort of that it's safe, it's approachable, and it's secure, so that there's no risk to them, and that they can just focus on how best to use those tools and support their patients with them. So yeah, that's a big thing. And then I would also just add to it, it's about also translating the nuance of the controls and the ways that they think about these activities, such that they're conducive to a therapeutic environment. So for example, patient-centered or client-centered care is practiced by 85% of therapists that work with kids. And what that means is that you almost let them choose the game or the activity, and then you meet them in that game and apply any of the therapeutic approaches so that they feel in control, and you're sort of leading from behind in that way. Now, if you're sharing a screen, if you're on a traditional video platform, you don't want to let them Google something, because that could go, awry. You don't want to you don't want to access anything outside of that. And if you just share a screen, well, now it's not collaborative. So that's where having the different rooms with different sort of toggles for what's included in them matters, because you are able to now toggle even within the experience. Okay, now I want it to be that it's the client and myself that is able to click on activities, versus just myself that can click on activities to maintain control. But it's really a controlled environment, because now they're only selecting things you've given them the option to select, and they're not able to select something that you wouldn't want. Another example is, for example, a sand tray. So sand tray is literally a sandbox, and sand play or sand tray is actually the most common and the oldest play therapy approach that's been adopted across providers. And so, yes, we have a virtual sand tray, and you can use that in virtual context. But we've heard from therapists a couple of things. One, some of them find sand trays gross. Some, with germs and things of that nature. Some find that you can only have such a large, like it can only be so big, and so you can only do so much creatively. And some kids actually find that a digital version of it, even if you're in person, actually enables more creativity and more flexibility. But then you have other providers that say, well, if you do that, now you're losing the kinesthetic aspect of the sand tray. And one of the problems that they would note is that, well, if we do something in a sandbox, there's no way for me to keep that sandbox untouched until their next session, whenever that might be. So that's where we've developed what we call the online to offline feature, which is you could take a picture of your sand creation, and it now uploads it and creates a 3D model and saves it to your virtual sand tray. So now you can still create virtually and engage physically, but also save and have continuity between the sessions, which is meaningful. So we're looking to do things that really reflect the therapeutic objectives and considerations, and translate that into an accessible and viable product.
Wow, it's really a robust product. So that sounds really exciting. And obviously, it helps a lot. As you mentioned, during COVID, we saw like everyone just went into the virtual world. But for example, I have kids, and my oldest one was in a stage like they don't really know a lot of how to work with the computers or follow through. And we saw they just lost interest at some point, like they're not engaged, and it's not the same like we as adults, you can share screen and I can just follow a link and go through things and just grasp things quickly. So this really solves that point that you mentioned, like they will have the interest, there's like this way to interact virtually, so it's really good in that way for both sides, like kids and then the therapists too, to really keep them engaged and have this customized plan. And well, goes a lot in line with what we're trying to achieve on the series we've been running, is how we're leveraging technology to support overall wellness within the population or the audience that we have. And this really resonates with what we've seen. Like we have the tools, in this case you're providing tools for therapists to really provide a great experience for children and making sure the outcomes are there. They can have a hybrid approach, let's say, but still the virtual component, the tools in place allow them to focus their attention and their strengths in what they do best, rather than look for something in place that it's out there within the internet, and then how they can maybe put it together and somehow meet the expectations or what they're trying to achieve. So sounds like you have it all.
Absolutely. And I'll just say there was a big study out of the UK where children, and again, they were using just a traditional video platform without any of these tools in it. And children said that their virtual therapy was not therapy, and it was not the same as what they had in person. So the patients didn't even view that virtual experience as the same thing as what they had. And so that's part of the problem, is as well as that, forget their own experience. It's the mindset about like what actually they're engaging in. And so if we can actually have consistency across settings, that is really helpful. And if you can now and just making experiences less sterile. I mean, there's a reason that, at the doctor's office or pediatricians, you can get a lollipop if you've been good during your checkup. There's that psychology, there's the trying to make it something positive. And I think we just like to say, okay, well, now that we have video, now everyone use video. Now we have AI scribes that are, being adopted for note automation. Well, now everyone do that. But are we really now assessing the nuances? Because healthcare is not one. Providers are all different. They practice in different ways, and there's not a one size fits all there. And so are we really thinking about those sort of micro markets and how the sort of implementation of technology needs to be considered and adjusted, and refined or tailored to those particular situations? And I think that's where there was a lot overlooked. And now we're trying to say that there's no reason with the way, like where technology is today, that we can't make those experiences better than just a video platform. And in general, make them potentially better experiences, because kids actually grow up with technology in many cases and are familiar with it. And so if we could just find that, perfect balance where providers feel that what they're doing is consistent with how they want to practice, not changing what they do and how they do it, but just giving them sort of a different vehicle to do what they're used to doing, to have meaningful impact at scale.
Totally, that's great. And also discussing probably this, maybe the flipping the coin for kids. They might not be as engaged sometimes virtually, but also we do know the majority of kids enjoy screen time. So having them with this approach also helps drive changes and make less, I don't know if it's boring, but not the same type of approach, right? Like there would be engaging activities, a different type of experience for them. So it's a really good way to focus their screen time, to put it in a way, on a manner that will be helpful for them, because it's specific tools or activities that will be customized for their goals at the end.
Yeah, and what I would just say on that is, when you're an adult and you go to therapy, you're listening to what the therapist is saying and going, does that sound right? Does that make sense? Like, does that seem credible? Does that apply to me? Yes, I can buy in. When you're dealing with a child, it starts with who is saying it. Do I know them? Do I like them? Do I even care to listen to anything they're saying? And it's all about that. You might not love your therapist as an adult, but if they're helping you and you think that they're smart and you think that they're capable, then you're willing to engage on the merit. Where with kids, it starts with who. And that's where it's, well, okay, well, if it's about who, like, it's, well, do I like them? Was this fun? You know, and do I want to go back? Was this a good experience? And that's what builds the relationship, which is why therapeutic alliance is important for anyone. But when it comes to kids and adolescents and neurodivergent individuals, it's the earliest like therapeutic alliance, which is that measure of rapport between that child and the therapist or anyone. It's the leading indicator of therapeutic success and the earliest indicator of therapeutic success. So it really is important to make that a fun experience, because that's how they form, you know, whether or not they associate you with fun or they associate you and who's saying whatever they're going to say with something that is an averse experience to them.
That's a great point that you bring. So totally in agreement. And the other question that might I feel, if I'm part of the general population and I know there's something out there, I think it's great to showcase what you're doing, what your platform does, because that way we can spread the word and say, if I have a therapist that I go with or I take my kids with, then it's a great way for them to let them know this is in place and then how they can use it, or just for them to explore and see all the benefits it has. So we're going to be sharing the link below on where to look for more information, how it works. But if you want to dive into a bit into how it works, feel free to share.
Yeah, absolutely. And I guess let me just say this, is that we don't have enough child practitioners, full stop. We cannot graduate enough of them to be able to serve the demand. And so that's where we're starting to see things like AI therapy and chatbots. There's a lot of conversations about all this. My view is there's a place for everything, but therapists are the center of it. You know, you might as a parent might not have many options while you're waiting, let's say on a wait list for care, or, you know, until you can go to that session. And so maybe having, let's call it a conversational agent, might be something that could be a benefit temporarily. But I certainly would not want to be the parent trying to find what is right and safe on the internet. And just as I bought my neck pillow from my physio, you know, I would trust the therapist or the clinic to say, hey, this is now something that I would recommend in the interim. So I think the therapist really is at the center of change and to having that impact. But what's interesting with the parents and you know, patients and other stakeholders is one of the reasons that it is so limiting is because only 1 in 10 sessions is done virtually. So these therapists still, like, this is their job. They still have lives. They still might have families. So if I'm going to pick my child up from school, I might not be driving back to the office to do an extra session at 7 p.m., you know, after dinner, or, you know, 6, something like that. And so now all of a sudden there's no capacity. Whereas if there now is, let's say, a virtual option that they can do, even if they are otherwise in person, well, now all of a sudden a slot opens up that makes, like, literally is increasing capacity and makes it more, you know, accessible to be able to receive care. So I think there's definitely the push and pull where therapists, you know, are rightly so not wanting to just jump on the newest thing and the most exciting thing, because they've worked very hard and are trained to, you know, provide effective care, and we should trust them in what is right and what's not right. But parents and others might be more, let's say, desperate, and might also have more of an interest, or might do, like, you know, research that might uncover things that if they share that with their providers, you know, it's helpful for them to then be aware, okay, this is maybe something worth looking into, and this is something my patients might require if, let's say, the parent is away or not able to drive them when there's availability and things of that nature to solve a problem. And so I think once they start getting some of that, you know, push from their constituents or patients or stakeholders, you know, then it might go, okay, well, maybe there is a place and there's openness to this, but that therapist might not want to be the one to say, you know, let's do virtual therapy, and have a parent who still has a hangover from Zoom school, you know, not wanting to do that. and, take the risk on this as a whole in terms of even exploring it because they're already so busy. So if it's that they think it's something that could help them and there's openness from the stakeholders they're trying to serve, it just makes it that much easier for them to buy in and to consider it, which is what's needed because it is, novel in terms of, this hasn't existed prior to COVID, but now it does exist, and the things that we are building and the tools that we offer are not actually different from what they are otherwise doing in person today. So it's really just that lack of awareness. And when you ask people, about a virtual playroom, their answer is not, oh, Playspace, it's what's that? Like, I haven't seen that, because it's just, it takes time to promote awareness and adoption. So yeah, just wanted to share that really is a piece of this, and just promoting awareness that things like this do exist so that people can explore it on their own time, I think is really meaningful.
Yes, I think that's a great thing to note. Creating awareness, it exists, how it works, how it's safe. And maybe one of the things that we haven't discussed is you are getting or incorporating feedback on how it is working for the providers, as you mentioned. This is an assumption I have, just want to confirm. And then you are always like maybe in the know, or trying to incorporate the latest regarding like AI technologies, compliance around it, security, all of those like things in your checklist.
Yeah, so what I'd say is we are definitely leaning into AI internally when it comes to building for efficiency. And we are absolutely exploring AI as it relates to like use cases that are either in session or for the therapist to support them. With that said, I think that AI is a term that means everything and nothing at the same time, which is very scary. And so when we think about AI, and it's not about hiding AI at all, it's the opposite. It's about being very transparent, but it's making sure that there's awareness of it, but in the context of its use case. So this is not about an AI storybook builder. It's about a story generator. It's not about AI notes. It's, note drafting support tool, right? And it's actually grounding it and then being transparent about how it works and what goes into that. And so, for example, we don't have the storybook, AI storybook creation live in session. Right now that exists only to prepare for the session. And the reason that we do that is because we don't want any images or stories immediately going to a child that were generated. What we heard from therapists, and this goes to your point on feedback and things of that nature, what we heard from therapists is that they would love to have it in the session, but they too have concerns of just having AI generated content immediately exposed to a child. And so that's where now we're working on a preview and approval and edit capability. So this way the therapist can see it and approve it before it goes to the child, but still do it live in session without it taking away from the child while they're doing that. And so that's the type of sort of approach that we have in terms of implementing. And then your point on the feedback, I just want to be clear that we provide tools to therapists. We do not prescribe to them how they should be used. We do not own their data. If they have any personal health information on our platform, which they can do because we're compliant, we are a custodian of it to them. The minute they want it back and deleted from us and not any part, that's what happens. We don't own it. So I just say that because we are not collecting outcomes on our therapist patients unless they're collecting those outcomes and they choose on an anonymized way to contribute that and they have consent to do so to broader outcomes. But traditionally, we work with organizations, hospitals, researchers, and things like that to validate impact, because we're not using our therapists' data to do that. But what I will say is, in terms of what I think is most meaningful for us in terms of feedback, is not necessarily the patient outcomes, which is incredibly important, and is something that they should implement, and we're promoting measurement-based care because we know so little, and most therapists don't collect outcomes and things from children because they can't even respond. And I mean, there's a lot of issues in that. But what I'll say is, for us, it's about, I'm not a therapist. I'm a beneficiary of it, and certainly our engineers are not therapists, right? And so we need to make sure that everything we are doing, from the prioritization of the design, the development, the testing, the implementation, like all aspects, incorporate therapists and diverse therapist perspectives. We have a global clinical advisory board. We have people that cannot sign into their emails, to people that built their own virtual reality playrooms in COVID. And those stakeholders and that diversity is really what's needed to ensure that the tools that we are developing have the proper considerations, and can be realized in practice by the providers in a way that is aligned with their approaches and capabilities. So to us, it's about how do we actually include them in the development and the refinement. And we are always asking for new games to build. We'll build games, we'll build tools, we'll edit things for our providers, and specific for them if they want that, because we're always listening. And I think the idea is we need to be a partner in both technology, business, play, outcomes, you name it, to them, and support them to meet them where they are without ever prescribing to them, and letting them guide the way. And we get more than enough feedback, because not many people are engaging with them to keep us gainfully employed for a while. So it's incredible to see the engagement.
Awesome. Thank you. Thanks for the response. And I know there could be lots of things that I could keep going and asking, but maybe the one of the final questions that I have at hand would be, I want to confirm we have audience in the US. So to know, like, is this HIPAA compliant? Perfect.
Yeah, so we are in right now Canada, the UK, the United States, and Australia, and it is compliant across all of those geographies, and there's some nuances between them that we are compliant. And I should also mention that we are the first and currently only SOC 2 Type 2 certified platform, which is even a higher threshold to HIPAA, because HIPAA, for those that just don't really understand it, HIPAA is a practice. You either are HIPAA compliant in terms of how you practice, or you're not. But it's not a certification. So it's not like there's really an audit for that. There can be, and you can be audited if you have an auditor, but no one's going around auditing individual things right now in that way. SOC 2 Type 2 is something where you actually need to get an external auditor to audit every aspect of your business, your operations, your development, and every aspect of your product and platform. And then they monitor that, and they get into every detail you can imagine for a period of time, and you have to maintain compliance within that period of time. On average, it's about 6 months. And then they do a full draft, like they will draft a report that is a certification. And so why that's meaningful is that it does take time. It's not cheap to do, because you have to hire an external auditor, like an Ernst & Young, for example, like someone would audit and do your taxes. It's the same thing for that. And so we are the only play-based engagement platform in the world for pediatric therapists that has that certification. And, we're always looking to do more and more, but that is a global sort of standard and independent additional piece. Now, we have to be HIPAA, to be clear, as well. I'm not, of course, taking away from that, but it's that folks can say they're HIPAA. You cannot say you're SOC 2 certified unless you truly have that audit and certification properly assessed and documented.
Thanks for that, and congratulations.
Thank you.
That's amazing. And actually, when I was looking into your website and all the information, you have lots within the news. I found that you had this certificate. So kudos, well done. I
Thank you.
know all the listeners that might have some concerns, because I know within healthcare that can be a concern. Well, that's something that will go away, I'm certain. And also for going more in depth as where are you currently offering the tool or is being used. So there's lots of reach for sure. Is there anything, as we wrap it up, is there anything else that might be coming up, anything that will be good for the audience or anyone listening to keep an eye for? Anything exciting on your end?
Yeah, so I mean, we have sort of two different themes of initiatives, if you will. One of them is an acquisition that we're going to be announcing, in the immediate term here, with a company that actually right now is already serving school boards and schools in the United States. It's a box of physical products that come with an app that will create different programming from those products. So, and it's about getting outside, physical activity, and things of that nature. And so why that's awesome is because just as schools need that for programming, you can have a soccer ball with cones, and the cones could be a net, or they could be lined up and you could do drills. And so it's about having those agnostic things, but I think it's the same thing with therapists. It's, they have their playrooms, they have lots of tools in it. How can we create sort of personalized, session plans, if you will, but not a traditional treatment plan, but more of a session engagement based plan that can take the tools that they have, or, provide them, let's say, a box of these agnostic tools, and then personalize that experience. So I think that's great, because it is not about making everything virtual. It's about finding the ways that technology can actually enhance and allow children to buy in, and certainly creating a personalized, play plan, if you will, is something that is fun and meaningful with physical products. Then the other thing is, I just got back from LA from Toy Previews, which is where brands like Hasbro, Mattel, and the likes of it are sort of showcasing new products, brands, initiatives, and things that they're doing. And we've heard from therapists, and there's diversity on this, but we've heard that just as much as it's important to have agnostic tools like a Sandtray, or like stories that are not necessarily character-based, that already have preconceived notions attached to them, or familiarity with, it's also helpful to have characters and or stories or activities that children are familiar with, because it just makes it that much more approachable. And we could have Pup Police, but that is not Paw Patrol. And so it's about we're now, there will be some announcements that are coming where we're actually now working with these brands who frankly have never thought about healthcare in their life. They're toy and entertainment companies. Healthcare is not where they distribute, and we get their order forms and their agreements, and it's how many stores are you in, what you're manufacturing, and it's like, no, it's not what this is about. But it's amazing, because there's so much openness to this, and we're really excited to be able to bring some of these brands and work with our providers to be able to apply those brands in ways that are impactful and beneficial in terms of the therapeutic aspect to them, but also engaging and fun in secure environments, and designed for those secure environments. So those are some initiatives that are going to be announced over the next month, 2, 3, that we're excited about.
Amazing. So yeah, great. Thanks for all the insights, for sharing all the information that will be valuable not only for parents. Let's say, I know if there's any pediatricians, school board members, therapists, like there's lots of members in the audience that can really make a change in spreading the word, in looking what's there, even like, as you say, like toy companies, that they can just spread the word and see how they can support children, because we know that's the future. So that's really good to know there's something out there safe, secure, fun to be working with. So thanks again, Matt. We'll be sharing all the information so anyone can follow you and see the latest and the greatest and have more
Thank you so
information.
much for the opportunity to spread the word on our mission and the platform that you bring to us. So thank you.
Have a great day, Matt.
You too.